Patient access is one of the most critical issues plaguing the current healthcare industry. My name is Sai Kisti. I'm a manager at Vynamic, and today I'll be walking you through our approach in partnering with a client to enable optimal patient access. The patients that wanted service in this organization were experiencing tons of frustration when they called the call center, when they tried to schedule appointments online, and in general, when they just tried to get an appointment in many different ways. Although there was a lot of passion and intention to solve this issue within the organization, the client called Vynamic because they really needed someone to come in and help with two critical needs. One, to bring a decentralized organization to the same table, and that involves an interdisciplinary group, more importantly, the clinical leadership that was not necessarily always at the table making these decisions, but were on the grounds facing the patients. And the second was to really drive from A to Z the execution of solutions. This is a universal issue. This is something that every single health system, every single hospital is dealing with. And for a chance to partner with our client to come up with innovative solutions that mean something to them and mean something to their patients was really a huge challenge, but also a huge form of excitement. We got a chance to tackle an issue that we also personally face in our day-to-day lives. We're all patients to some extent, or our loved ones are, and this really hit home as a personal issue. When we solve for true patient access, it not only betters outcomes for patients and their families, but also opens the door to increasing health equity. Patient access is a simple term, but it actually requires a lot of complex thinking. Vynamic was perfectly positioned to partner with our client because we understood that enabling patient access was the first critical step to truly engaging with the patient, all the way from first contact to post-discharge. The important questions we needed to answer in order to get to a solution and a future state was answering the who, the why, and the how. The first step was setting up a governance model to ensure we had utmost clarity when it came to decision-making, as well as organized discussion. The second was establishing why, and that was done through current state assessments that not only looked at the organization's internal issues, but also looked outwards at industry trends to inform where we should be. By looking outward to learn from the industry, our client really sought to push the boundaries and expand and go beyond the current standards of excellence. Once solutions were brainstormed, we had to undergo an exercise of pressure testing the how to see if it would actually make sense and if it would actually be feasible. That was done through an assessment against an impact and feasibility matrix that pushed out the highest priority projects so that the organization could then focus investments and energy on. We went to departments, we addressed critical needs, we addressed barriers in real time that then provided a baseline and a strong foundation for taking these pilots and scaling across the enterprise. Sustainable solutions require long-term effort as well as perseverance. A key patient access metric is the ability to self-schedule or schedule online. Through our work, we actually saw a jump of upwards of 40% of patients now being able to schedule appointments online that they weren't able to before, and actually enabled patients to get in much quicker to see their providers and get their care. This project was invaluable to our client because we've created a foundation for them that can last for years and years and evolve with them over time. Great patient access leads to true patient engagement. There's an opportunity to replicate these successes at other health systems and hospitals who are passionate about patient access.